Today I want to talk to you about some options for treating piriformis syndrome. And these techniques can give very good relief, sometimes permanent. Now the thing about piriformis syndrome is that it mimics sciatica almost exactly. The symptoms being sharp pain, nerve pain into the back of the hip, to the gluteal muscles, and similar symptoms down the back of the leg, and often into the calf, and even into the foot. Now sciatica is caused by impingement of the sciatic nerve at the spine, where you have disc bulges and similar problems. Whereas piriformis syndrome is caused by impingement of the sciatic nerve at the back of the hip, where it runs very close to the piriformis muscle. Now some of the treatment options we're going to talk about today involve stretching and some work near the spine. So you need to make sure you haven't got actual sciatica or nerve impingement caused by disc bulges or anything like that, because otherwise the stretches may actually exacerbate the problem, and that's not what you want. Now in this picture you can see how the piriformis muscle attaches to the sacral area at one end and the head of the femur at the other end. And you can see how the sciatic nerve runs very close to the piriformis muscle. So to treat piriformis syndrome, there are 5 techniques that I particularly like. And they are massage, heat, muscle stretching, nerve stretching, and nerve flossing. So let's go through them one by one. Now to massage the piriformis muscle, you've got a few options. You can use a tennis ball, or you can use the back of your fist, or if you've got a friend, they can use their thumbs or even their elbow, but it's a good idea to use the thumb first to find the right spot and then use that to guide the elbow in. And you or your friend should exert the amount of pressure that gives you a mild discomfort, not a strong discomfort. So if you want to think of it in terms of a scale of 1 to 10, where 10's excruciating, maybe a 6 out of 10, and then you should be okay. Okay, now to find the right place, you need to go into the back of the hip. So the back of the hip, where the head of the femur, the long bone in the thigh, is forming a big ball, and there's a spot in the back of the hip you should be able to find that's a little bit soft and your thumb can sink in, and if that's the right spot and you've got piriformis syndrome, you should feel a little bit of pain when you hit that spot, and then you know you found the right spot. So it's sort of halfway between the center and the side, and just a little bit below the belt, and that's the spot you should find, which your finger will sink into fairly easily. Okay, then you can get your ball and put it there and sit down and drop some weight onto it and move it around for a few minutes and give it a good massage. Or you can do the same thing with your knuckles if you've got strong hands. Make a good fist, get the nice big knuckles there into the right spot and sit on that and move around. Or you can lie on a table face down and your friend can press in with the thumb or with the elbow. Now with heat you've got quite a few options. You can use a gel pack or a wheat bag, or you can have a hot shower or a hot bath, or you can use exercise. Now if you're okay to exercise and exercise doesn't give you pain, some brisk exercise is a good way to warm up your body. And if you've got time for a hot bath, a long hot bath, that can also be very therapeutic. And a very good thing to do after your hot bath is do your stretches. Now there are three main stretches that I recommend. The main one is for the piriformis muscle, and I'll show you that now. So first thing you do is bring your foot over the other leg, bend both knees, and then you reach through the gap with your right arm, assuming it's your right leg, and hold below the knee and draw your left knee towards your chest gently, and that will stretch your right piriformis and gluteal muscles. So you're getting a bonus stretch into your gluteal muscles, because gluteal muscles often cause lower back pain as well. Okay, and you hold that stretch for about 30 seconds. Now the second stretch is for the lateral lumbar flexors, muscles that stretch sideways. So the best way to do this is sitting in a chair. You put your arm or hand on your hip and the other arm over and stretch sideways until you feel a nice stretch at the back and the side. Hold that for about 30 seconds, come up very slowly, and then do the other side. So that's good for balance. You should stretch both sides. Same with the glutes and the piriformis stretches, you should also stretch the other side. Okay, and the last stretch, the third stretch I want to show you, is for the spinal rotators, the muscles that twist the spine. So you can lie on your back and put your arms like that, and then lift your legs in the air and drop your legs from side to side, holding your feet quite high, level with your head if you can. If it's too hard to do, you bend one or both your knees so it's less strain on the back if that's a problem. Now a good way to stretch the sciatic nerve is to put your foot up on the table while you're sitting on the chair and get a small hand towel and put it just below your toes, and then holding your head forward slightly so you're getting a stretch in the back of the neck, pull the towel and straighten your knee until you feel a strong stretch in the back of your knee, and that's your sciatic nerve stretching. And then bend your knee, relax, let your head go back a little bit, bring your head forward and straighten your knee, pull with your hands and relax. Hold each stretch for a couple of seconds and repeat about 5 times. Now to floss the sciatic nerve so it can move and slide freely back and forth through the area where the piriformis muscle is, you relax the nerve at the top end by letting your head go back, and you straighten your knee and pull your toes back. And that's drawing the nerve towards your feet. And then to floss it the other way, you bend your knee, even point your toes and bring your foot down and draw your head forward strongly. And that's drawing the sciatic nerve upwards towards the head. And then you repeat. Relax top and draw towards the bottom by straightening the knee and pulling. And you relax the bottom and point the toes, pull the head forward and repeat about 5 times. And that's flossing the sciatic nerve. So those are the 5 techniques that I recommend for treating piriformis syndrome. You can do all 5 of them daily, or you can leave out 1 or 2 that may aggravate or perhaps be inconvenient because you haven't got somebody to massage you, for example. Now with the massage, I recommend 5 to 20 minutes per day. With the heat, I'd recommend a similar amount, 5 to 20 minutes per day. The heat should be just before or just after massage to be effective. The stretches, I'd recommend once per day for 30 seconds. Hold your stretch for 30 seconds and make sure that you haven't got any pain. The stretch should be pleasant. The stretch is ideally done after massage or after heat when the muscles are nice and relaxed and ready to stretch. The nerve stretches, maybe 5 to 10 repetitions per day, and hold each stretch for 2 to 5 seconds. With the nerve flossing, again 5 to 10 per day. Now lastly, I'd strongly suggest you make sure that you haven't got any problems with your spine, disc bulges or anything like that. So see your doctor to make sure that's the case, and if it's all clear, then you're ready to go for it. So good luck.